The retirement home dialed 911, bracing for the worst. 84-year-old Mr. Larson suffered a catastrophic heart attack, a near-certain death sentence. But the soft-spoken night nurse didn't hesitate for the ambulance. She cracked open his chest right in the corridor. "Ma'am, you're not authorized for surgery." But Sarah Bennett had done this before in war zones where delays meant death. Welcome to Unsung Heroes. Before we dive into this remarkable tale, drop a comment with the city you're reading from today. If you want more stories like this, hit that subscribe button and give us a like. Sarah Bennett was the ideal night shift nurse. At 44, she'd been at Golden Haven Retirement Home for 4 years. She clocked in at 11 p.m., clocked out at 7 a.m. Never skipped a patient report, never showed up late, never grumbled. Everyone on the night shift adored Sarah. She was steady, dependable, and could always locate a missing item. Residents found solace in her gentle hands and soothing voice. Sarah's colleagues were Michael Carter and Emily Nguyen. Michael, a 30-year-old paramedic, had 5 years of ambulance experience. Emily, 35, was a seasoned nurse with 8 years at Golden Haven. But Sarah stood out. Her medical expertise went far beyond standard nursing. In emergencies, while others checked basic vitals, she conducted in-depth assessments. "Why do you examine so thoroughly?" they'd ask. "Just habit," Sarah would reply softly. But that habit stemmed from extraordinary places. Sarah's equipment checks were unlike the others. She inspected every tool with surgical precision, syringes, airway kits, defibrillators, like she was prepping an operating theater. Her co-workers found her methods odd. "We're paramedics, Sarah, not surgeons," they'd say. Sarah would give a small smile, saying nothing, because they were mistaken. Her medical knowledge left even senior doctors in awe. "Where did you train?" they'd ask. "Various places," Sarah would answer vaguely, never elaborating. Those places were far from typical medical schools. That Wednesday night began like any other. Sarah, Michael, and Emily handled routine calls, a minor slip, an elderly patient's fall, chest discomfort, standard night shift fare. But the call at 2:47 a.m. was anything but ordinary. Sarah Bennett's choice to enlist came at a turning point. In her final year of college, medical school rejections piled up. Instead of giving up, she forged a new path. The Army became the start of her medical journey, not the end. She began in the Medical Corps, but after basic training, she was chosen for more. Advanced Combat Medic Training, an elite program. That was just the beginning. Special Operations Medical Training followed, battlefield surgery, life-saving procedures in extreme conditions. Sarah was among the top 1%. That expertise would prove critical in the retirement home that night. Her first deployment was in Iraq, with a forward surgical team operating on injured soldiers before they could reach a proper table. Battlefield medicine reshaped Sarah. Her second deployment, in Afghanistan, attached her to Special Forces. She treated gunshot wounds, blast injuries, and complex trauma in high-stakes missions. The techniques she mastered weren't taught in civilian hospitals. Sarah learned to work silently, with minimal tools, maximum efficiency. Her hands became her instruments, and those hands would draw attention at Golden Haven that night. Her third deployment, near the Syrian border, involved Black Ops medical support, combat surgery under gunfire. Sarah was now as skilled as a field surgeon. But why had she left the military for nursing? That was a layered story. PTSD, reintegration struggles, and civilian life challenges weighed heavily. Sarah's transition was rough. High-pressure medical work felt familiar, but civilian bureaucracy was stifling. That tension was about to erupt that night. After an honorable discharge in 2021, Sarah entered civilian healthcare. She sought PTSD therapy, readjustment counseling, and career support. Hospital nursing felt right. It rekindled her passion for helping the vulnerable. The hospital was stable, predictable, a welcome calm after years of chaos. When Golden Haven hired her, Sarah was overqualified. Bachelor's in nursing, military medical training, advanced certifications. The hiring board didn't probe deeply, they were just thrilled to have her. Day-to-day tasks were simple compared to combat medicine. But Sarah noticed details others overlooked: a resident's irregular breathing hinting at early COPD, a patient's dizziness suggesting potential neurological issues. Her assessments were meticulous, her referrals spot-on, her follow-ups flawless. Yet she never spoke of her past. "I've always loved helping people," she'd say. A simple answer, no details. At 2:47 a.m., the alarm that would unveil Sarah's 14-year secret blared through Golden Haven. Emergency alert. Room 12. Mr. Larson, 84 years old, massive myocardial infarction, cardiac arrest imminent, code red. Sarah Bennett's entire body snapped to attention. This wasn't just a nurse's reflex, it was the instinct of someone who'd saved lives in war zones. They raced to room 12. Michael was taut but focused. Emily was prepping equipment. Sarah moved quietly, but her silence carried weight. A soldier's silence. "This looks serious," Michael said, sprinting down the hall. "We're ready for anything," Emily replied. Sarah stayed silent. She knew exactly how serious it could get. When they reached room 12, the scene was dire. Mr. Larson lay in bed, ashen, drenched in sweat, clutching his chest, gasping. His eyes were wide with terror. "My chest, it's splitting open," he groaned. The retirement home staff was in chaos. The on-call doctor was still en route. 911 was called, but the ambulance was 15 minutes out. Michael and Emily started basic vitals, but Sarah's assessment was deeper. "Michael, Emily," she said, voice steady. "This isn't a typical heart attack." Michael checked vitals, pulse 118, blood pressure crashing, severe shortness of breath, crushing chest pain. "Hook up the EKG," Sarah directed. The EKG screen lit up with a grim picture. "STEMI," Sarah whispered. "ST elevation myocardial infarction. Major artery blocked." Michael blinked. "Sarah, how do you?" "Oxygen, now." "Aspirin 325 milligrams, sublingual nitroglycerin," Sarah ordered. As they treated Mr. Larson, his condition plummeted. His eyes rolled back, body stiffened, then went limp. "No pulse!" Emily shouted. "Cardiac arrest." The monitor flatlined. Michael started CPR, but Sarah stopped him. "Wait, Michael. This is ventricular fibrillation. We need defibrillation." "Sarah, there's no defibrillator here." Sarah reached into her bag, pulling out a compact, advanced defibrillator Michael had never seen. "Stand back." She delivered the shock. Mr. Larson's body jolted. The monitor flickered, heart rhythm restored. How did you do that?" Emily stammered. "Training," Sarah said curtly. Mr. Larson's heart was beating, but his breathing faltered. His lips turned blue. "Oxygen saturation 76%, Michael reported. "Critical." Sarah listened to his chest. "Pulmonary edema, fluid in the lungs from heart failure." "What do we do?" Emily's voice cracked. "Intubation," Sarah said firmly. "Sarah, we can't intubate. That needs a doctor." Sarah pulled a laryngoscope and intubation tube from her bag, professional grade, like a surgeon's kit. "I can do it." Michael froze. "Are you a doctor?" "I'll explain later," Sarah said, gloving up. "First, I save his life." With flawless precision, she intubated Mr. Larson. His vitals stabilized. But then his blood pressure tanked again. His pulse raced, then weakened. Sarah pressed her stethoscope to his chest. "Heart sounds faint. Jugular vein distension." "What's that mean?" Michael asked. "Pericardial tamponade," Sarah said. "Blood pooling around the heart, compressing it. It can't pump." Emily paled. "How do you treat that?" Sarah's answer stunned them. Pericardiocentesis, needle to drain the blood. Sarah, that's heart surgery. Not in a retirement home. Sarah looked at Mr. Larson, fading fast. The ambulance was still minutes away. I'll do it. From her bag, she produced a long, thin needle. No ultrasound, just her anatomical expertise. Sarah, if you miss. I won't, Sarah said. I've done this 29 times in Afghanistan. Afghanistan? Michael and Emily gasped. Sarah inserted the needle into Mr. Larson's chest, guiding it toward his heart, monitoring his pulse. Dark red blood flowed from the needle. Tamponade draining, Sarah said calmly. Mr. Larson's blood pressure climbed. His color returned. Unbelievable, Emily whispered. Ambulance sirens wailed in the distance. As paramedics rushed in, Sarah packed her gear. Michael and Emily were speechless. Quiet nurse Sarah had just performed cardiac surgery. Sarah, Michael said, voice shaking. Who are you? Sarah peeled off her gloves. Major Sarah Bennett, Army Special Forces Medical Corps, retired. That night, a life was saved because an unassuming night nurse was a combat surgeon. Michael and Emily were stunned. Sarah, why keep this secret? It wasn't relevant, Sarah said. I'm a nurse now. No, Michael said, shaking his head. You're a hero. As they headed to the hospital, Michael and Emily saw Sarah differently. Who was this woman? What had she endured? Sarah was finally ready to share her story. At Golden Haven's emergency department, Dr. Patel, the attending physician, reviewed the case. Who provided initial care? Our nursing team, Michael said. Dr. Patel studied the chart and froze. This is remarkable. Intracranial pressure management, advanced chest decompression, complex trauma stabilization, surgical level care. Sarah was quietly cleaning her tools, but Dr. Patel's next question would expose everything. Who performed this? Michael and Emily glanced at Sarah. She stepped forward. I did, Doctor. This is residency-level trauma surgery. Where did you train? Sarah took a deep breath. Army Special Operations Medical Training, Combat Surgery Specialist, 3 deployments. Silence. It all clicked. You're saying our nurse is a former military surgeon? Dr. Patel asked. Not just a surgeon, Sarah clarified. Special Operations Field Surgery, under hostile conditions. Michael and Emily were still processing, but Dr. Patel's next question reframed everything. What rank? Major, Combat Medical Specialist. That rank gave even Dr. Patel pause. Major, your combat experience surpasses most of our trauma surgeons. Sarah was humble. Different world, Doctor. I'm a nurse now. But Dr. Patel's next offer would shift her path. Major Bennett, would you consider joining our trauma surgery team? Sarah blinked. I'm not board certified as a civilian surgeon. We can fix that. Your skills, we need them. What would Sarah decide? Michael and Emily were in awe. Their colleague was a major, a surgeon, a hero. Sarah, why hide this? Sarah's answer echoed military ethos. The Army teaches you to act, not boast. You show what you can do. That philosophy had defined her civilian career. In the weeks that followed, Sarah took on a dual role, nursing shifts and trauma surgery training. She became Golden Haven's greatest asset. Her reputation spread, the nurse who was a surgeon. Stories circulated in the medical community, inspiring other veterans. Young nurses sought her guidance. How do you stay so calm? Experience. Training. Knowing every case matters. Sarah launched a mentorship program for military to civilian medical transitions, helping veterans find their path. She wasn't alone. A specialized trauma unit was established at Golden Haven, with Sarah as lead surgeon. Her military expertise transformed civilian care. A year later, Sarah became Dr. Sarah Bennett, board-certified trauma surgeon. She never shed her nursing roots, they shaped every choice she made. Battlefield medicine teaches you differently, she'd say. Every second counts. Every patient deserves your all. Michael and Emily joined her surgical team, creating a nurse-to-surgeon pipeline that revolutionized the hospital. Sarah's story gained national attention, a military-to-civilian healthcare success. Other veterans were inspired, but Sarah's greatest impact was still unfolding. She now trains transitioning combat medics, completing the circle. Your service doesn't end with discharge, she tells them. It evolves. Your skills, your grit, your heart, they carry forward. Those hands, once steady in combat zones, now train the next generation, teaching precision, building confidence, passing on expertise. Michael and Emily, her closest colleagues, say proudly, "We learned from a legend." Because that's what hidden legends do. They don't hide their past, they use it to forge better futures. In Sarah's office hangs a single photo, her military medical team in a war zone, a reminder of her roots and a beacon for her future. So, I ask you, have you ever been treated by someone like Sarah? A healthcare provider whose military past you didn't know, whose skill was exceptional. Share your stories in the comments. Here at Unsung Heroes, we know the greatest healers often wear the humblest uniforms. If this story resonated, share it, subscribe, and help us tell more. Until next time, remember, your healthcare provider might have saved more lives than you'll ever know. Service never stops, it just changes uniforms.